My name's Dr. Catherine Akielny from Farming Connect, and I'm here today to talk about tackling lameness in sheep with Kate Hobers, who's an independent veterinary surgeon and who's got 35 years plus experience of working in the sheep industry. So we're going to have a chat through some of the main points with regards to tackling lameness in sheep. So first thing really is, Kate, is when's lameness a problem, and how big a problem is it for sheep flocks?
It's a very big problem for some flocks, and it can be a problem at any time of year. Certainly in the UK, we have no what we call non-transmission period of time, which makes it more difficult to control and maybe eradicate foot rot than maybe the southern hemisphere. But we certainly know that lameness will have a major effect on productivity. Quite often we think about losses when you see a dead animal. That's not the case with lameness. We all know that a thin ewe will have poorer lambs. She won't produce as good colostrum. She's more likely to lose a lamb. She's more likely to have singles than twins. So that's the whole, that's the whole life cycle. That's her productivity largely affected. Lambs, when they're growing, if they're lame, it not only affects their growth rate. Quite often you might have an outbreak of scald or lameness. Just as you're wanting to sell lambs, you obviously can't sell lame lambs. And if you have a ram lame at topping time, well, if a ram is lame and that affects his fertility or his interest or ability to work, that's messing up your whole year, because we only have a few weeks for rams to be as fit and fertile as possible.
And I assume, given that the length of time it takes for semen production in a ram is 6 to 8 weeks?
At least a minimum of 6 to 8 weeks. So rams need to be sound a good 2 months before topping. So really we need to concentrate on them a little bit sooner, make sure they're sound in every way, but particularly not lame, and monitor them well.
So
and certainly sometimes I get questions about, can I give antibiotics to a lame ram? Will it make it infertile? No, there's very few antibiotics and none that you would routinely be using for lameness that are going to make a ram infertile. The pain from lameness or running a temperature, that's what might make them infertile. So the sooner they have antibiotics to cure the lameness, the better.
So we're really thinking of ram preparation there as a summer project for autumn use, really, with the rams.
Definitely.
Yeah. Okay. And in terms of lameness, so what are the main causes? Because I'm aware there's lots of different causes of lameness, but are there some of the main ones that
the main ones? Yeah, foot rot and scald, which are almost interchangeable. We know they're caused by the same bug, Dichelobacter nodosus, of which we've got about 10 strains in the UK, and we know they're present on the majority, 95–98% of UK farms. To a lesser degree, some have little lameness, some have major problems. Scald is interdigital dermatitis, is often an earlier stage. It causes bug causes the damage between the cleats, and then from that damage the bug gets into the feet and causes the more severe foot rot. Some strains of Dichelobacter are more what we call virulent, so nastier, so they will cause foot rot more quickly. Cod is a different disease caused by a spirochete. It's likely that it may get, one of the ways it might get in is when sheep have already got foot rot. That's not proven, but it seems to be worse on farms with a bad foot rot problem. And as we know, nearly every farm has got foot rot. You need to control that as well as cod. The difference clinically is that cod starts at the top of the clee, above the foot, and very rapidly spreads down the foot. When it first gets into a flock, it will cause a very severe lameness, such that the feet, the cleats, will start falling off, and quite rapidly, and is very painful. That is a stage that you've actually got a chance of getting on top and getting rid of it. But if you don't manage, then it tends to settle down to still nasty, but not as severe after a year or so, but you will get flare-ups.
And if you're concerned, I mean, how will somebody tell the difference between foot rot and cod when you've got maybe mixed infections? Is it quite hard to tell the difference between the two?
It can be once you get a mixed infection in a foot, and what I would suggest is you work with your vet. If you've got a serious lameness problem, it's certainly worth having your vet out to go through and do a specific plan for you. Or if when you're vet who's interested in sheep is on the farm for any reason, get them to have a look at a few of the sheep, and then you can sort out the correct antibiotics and have an antibiotic program for what you should or shouldn't be using as well, and that's quite important, as we'll say later.
I think we'll come on to have a chat about different antibiotics later, because they are different treatment options for the two diseases. So in terms of tackling lameness, what's the best approach to dealing with it? Because I know it can be quite frustrating when you've faced with lame sheep. And
it can be, and the important thing is to do all the treatment, to try and improve the immunity or the resilience of your sheep against the infections that cause lameness, but also to reduce the infections. And that's how the 5-point plan was devised by the FAI Farms and Ruth Clements. The actual information in it isn't really anything new, but it's been packaged so that we can all pick up the different parts and make us remember that we need to do everything, and it's not just a long list of things.
So there's no quick and easy answer.
There's no quick and easy answer, but people that work to the 5-point plan or work to both reducing the amount of bugs in the environment and increasing the resistance of their sheep will get on top of foot rot, and there's some people that have made quite dramatic improvements.
Yeah, as I say, we'll talk a little bit more, but I've come across people again who've gone from significant problems to really not quite eradicating lameness, but getting to such a low level where they find it's manageable or not an issue.
And the thing that everybody says after that is, I knew lameness was a problem, but I didn't know how much time it was taking up.
Yeah. Right, so one of the things I mentioned in the 5-point plan was vaccination. So could you just say a little bit about how vaccines work and what the options are for foot rot and lameness in sheep?
Yeah, the principles of vaccination is you give a small amount of a disease, that's not enough to actually cause the disease to an animal. They recognise that and build up their own antibodies so they have an immunity and stop that animal, or help stop that animal picking up disease and being ill with it in the future. There's only one foot rot vaccine in the UK, which we see a picture of there, and it includes the 10 common causes strains of Dichelobacter nodosus that are present in the UK. It's unusual for a vaccine in that it will actually treat disease as well. We see once you've vaccinated a whole flock, the level of lameness from foot rot will decrease, sometimes quite dramatically, about 2 to 3 weeks later. So it's an unusual vaccine, and there are different ways it can be used into a control program. So what I usually say, I can talk generically about the vaccine. It's a very important part of the 5-point plan, but it's best discussed with your sheep flock advisor, whether that's your vet or your SQP.
And if you've got cod in the flock as well, how does the vaccine, does it have any effect on cod? And if so?
It doesn't have any effect specifically on cod, but as we know, virtually every flock also has foot rot. It will decrease the amount of foot rot, so you will have fewer lame sheep. They may or may not get cod as severely, but you will also be able to pick up the ones with cod and treat them more promptly because you've reduced the amount of foot rot.
And I suppose if you're avoiding damage from foot rot to the foot, it's harder for that cod to kind of get
possibly, we think so.
Yeah. And are there any interactions with any other vaccine or any other treatments and veterinary treatments?
Not with any vaccines, although no, it shouldn't be given within 2 weeks of another vaccine, which is standard advice for different vaccines. But it's very important that if sheep have had foot vax, they should not at any time be injected with moxidectin 1%. They can receive moxidectin drenches and moxidectin 2%, but they should never have the 1%. There's some kind of allergic reaction with what we call the excipient, which is the stuff it's dissolved in.
And so I've heard some people say, obviously, you can get some lumps when you use the foot vax.
Yeah, it's an old vaccine, so it's dissolved in oil, which will cause lumps. So it's very important to use a clean syringe and needle. I usually recommend a steromatic system, and I say to change the needle more often than you would normally. And also it's important that it goes under the skin, so giving it in the neck but with a good fold of skin in the neck, because if it goes into the muscle or the fat, it may be more likely to produce a bigger lump. It's quite usual to get sort of some lump at the injection site that will go down over a month or two, and that's one reason why you shouldn't do it shortly before shearing, because there'll be a lump getting in the way.
And then something like using the vaccine in dry weather, I suppose, would help.
That's really for all vaccines. We shouldn't. You shouldn't use any injection in wet sheep or in dirty areas. When skin is a really good barrier to the bugs that either live on the skin or in the environment. When it gets wet, it gets a bit more porous. So when you put a needle through the skin, although it's only a tiny hole, it's tiny enough for bugs to get in, and it takes longer for that skin to heal over. And also the level of bugs on the surface of the skin are much higher on wet skin.
Yeah, so very much making the most of the right conditions to vaccinate.
Yes.
But also not using different vaccines within 2 weeks of each other, so you're not overwhelming and going against the license. So trying to plan ahead, I suppose.
There are a few vaccines that will have a license to be used with others, mainly in cattle, and that's because they've been tested. Most don't. And whereas there's no absolute evidence, we take it from principles of an immune response, it will take about 2 weeks for the body to get a good immune response. So we really want it to be working on one vaccine and give it 2 weeks before you gave another one, because if you've paid out for a vaccine, you want to give it the best chance of working that you can. The other thing is, I'm often asked, can I give a fluke or a worm drench at the same time? It's not that the vaccine would react with a fluke or a worm drench, it's that if your animals need drenching, we know a high parasite burden will adversely affect the immune system, and liver flukes specifically because they damage the liver, and the liver is very important for making antibodies. So ideally you would treat that first so your sheep are as healthy as possible and respond as well as possible to any vaccine.
Yeah, so planning ahead wherever possible.
Yes, yeah. Sheep's life is quite complicated because there are so many things we need to do to them, which is why sometimes certainly vaccination programs a lot trickier for sheep than cattle, and you need to sit down and think about when things need to be done.
Yeah, and get good weather, simple.
And get good, yes, living in Wales, well.
The other thing they mentioned in the 5-point plan was culling. So how do you view, and what's the best approach to cull in terms of what animals to identify for culling and how to go about doing it?
And certainly with the FAI, when they were first developing the 5-point plan, they found their farms that got the poorer response were probably not culling persistent offenders. But we talk about persistent offenders, so that's animals that have 2 or more cases. That doesn't necessarily mean 2 or more treatments, because if an animal has a severe lameness, it may need 2 or more injections of antibiotic or appropriate treatment to get it sound again. But it's after that animal's got sound again, recording it in some way so you know if it gets lame again. And recording, some people are doing good EID recording, but there's no reason you can't just put a bit of pitch on a sheep, or even someone gave me the tip of putting a cable tie through the ear tag. So a black cable tie means had 1 incident, 2 black cable ties is a very naughty sheep. The other thing I would say is if you keep your own replacements, ewe lambs from a chronically lame sheep are A, likely to have the genetics to be more susceptible to lameness, and B, would have spent more time walking in footsteps that have got infection in, so more likely to be already infected.
Yeah, and although culling's an important part of it, I've heard people who have rely too much on culling actually find that they don't.
Yes.
I know I've heard of people, once they bring in vaccination and culling, the 2 combined seem to have a bigger impact.
Yeah, what I generally say is Culling is very important. Start with everything else first so you can get the level of lameness down to a level that you can then pick out the ones you need to cull. If you've got a high level of lameness, 10, 15, 20%, there's probably so much infection going around that a lot of sheep will get lame again, and you're not necessarily picking out the ones that we're talking about, persistent offenders, once you've started your program and you've got things under control. And also sheep with chronically misshapen feet, that usually means they've had persistent foot rot and they're ones to go. Just one thing I also remember, people often say, well, you can't take lame sheep to market. That doesn't mean, if we're talking about culling, it doesn't mean treat them at their repeated episode of lameness. It means treat them, get them sound again, and then don't say, oh, well, she can have another lamb after all.
Yeah. So be strict on when they need culling.
Yes, yeah, which means identifying them, whether it's with picture or a cable tie or your EID recording.
Yeah.
Whatever works for you, really.
So again, you can start this program any time of year, but in some ways, your post-weaning to tupping is quite a good time, because if you are culling,
yes,
it helps to kind of, that's a good time of year to cull, really.
It is, and these persistent affected foot rot sheep are the ones that are going to have a poorer scanning anyway, so you're building yourself a healthier flock.
Yeah. The other thing you mentioned then is avoidance. So what does that mean in practice?
That means trying to avoid having an environment that's ideal for the bugs to survive. We know they'll live for about 2 weeks off the feet, and if you've got warm, wet conditions, whether that's inside or outside, the bugs love to survive and may even breed. So having plenty of clean straw when you're inside, maybe even having lime or disinfectant granules below the lime to kill off some of the bugs, and just avoiding damp areas. Outside, things like avoiding muddy gateways, or ideally avoiding gateways. If you watch sheep and they've got kept in 2 fields with a gate open, they will walk through that gateway several times a day, and that's a small area that one lame sheep will leave some of the foot rot bugs there, and then every other sheep will walk over it 2 or 3 times a day. So best to graze one field and then open the gate and move to the next field, for grazing management reasons as well. Also things like creep feeders or energy or mineral licks outside to try and move them round. And if you think of lambs, if you've got a creep feed, they probably go in there 3-4 times a day. If you've got one lame lamb, all the others will go where they've put Dichelobacter on the ground. You'll get some more lame lambs, and very rapidly, particularly if it's a little bit muddy, you'll get sort of a whole area full of infection. And I think that's why we sometimes see sort of huge, sudden, big outbreaks of scald in lambs. And remembering actually that lambs will quite often lie together, so you're getting an area where they're all lying and getting up and putting the Dichelobacter from their feet onto that area. Yeah.
So when it comes to handling systems, obviously there are big things to change, but maybe just thinking, if people can, a little bit about how the design and maybe movements of sheep in and out, so they're not, and again with sheds, stopping water leaking so you're not getting damp straw, and just trying to kind of
and definitely remembering every time you get your sheep in, you might be getting them in, for example, to drench them, so that's in your mind. But if 1 or 2 have got foot rot, they're all going to be milling around in the handling area for an hour and transferring those foot rot bugs, which go from foot to floor to foot. So avoiding spreading it every time you gather the sheep in, and that's having good dry concrete, scraping the concrete, and keeping everywhere as dry and clean as possible.
Yeah, because the bacteria that causes scald one of the bacteria tends to live in feces as well.
Yes.
So avoiding kind of standing in muck was it's going to be helpful. So treatments. So obviously there's different. We've got scald, foot rot, and cod as your 3 main ones. I know there's other causes of lameness as well.
There are that are important to the individual, but maybe not overall. We could perhaps just mention a couple at the end, but really treatment, once infection is in the foot, so foot rot or cod, we're really talking about antibiotics, and what antibiotics you use depends whether you have cod on the farm, and so that's a discussion with your vet. The good thing is that These can both be treated without needing to use what we call the critically important antibiotics, that the ones we have more concern about overuse that might be used in human use and other areas. For most sheep diseases, we can use some of the sort of older antibiotics that we have little resistance to in sheep diseases at the moment, so that's a good plus. If sheep have only got interdigital dermatitis, or scald as we all calls it, and it hasn't got in the foot, then we can treat with topical treatment, whether that's an antibiotic spray or going through a clean, appropriate foot bath. But once it gets into the foot, they probably need the topical treatment as well as an antibiotic injection.
Yeah, and just to be clear, foot rot and cod need different antibiotics. So if you're using a traditional antibiotic on lameness and they're not responding, you're not getting a good response, it's obviously worth then speaking to the vet to see if it's
it certainly is. Yes, the antibiotics we would use for cod will usually treat foot rot as well, but some of the antibiotic purely for foot rot, whereas in theory in a laboratory they'll kill cod bugs. In a practical situation they're not as good at killing cod bugs.
So don't keep on using the same one if you're not getting that response. It's probably worth chatting to your vet about it anyway. That's part of your flock health plan, regardless.
That's right. Yeah,
just checking up on that. Okay. Quarantine is the final one I think mentioned. So how important is quarantine and biosecurity?
It's very important. If you haven't got cod in your flock, you really don't want to get it in. And the way you're going to get it in is with sheep. So it'll be sheep you buy in, or you bring back from market where they've walked through something, or you bring back from tack, or they've travelled with something else, or sometimes some stray sheep jump in with yours. But it's really important that all sheep that come on the farm go into quarantine and sort of look for lameness. Also, you might think, well, I've got a bit of foot rot, so it doesn't matter about this bunch of ewes or this ram that got a bit of foot rot, I'll treat it and turn it out. I've already said there's about 10 strains in the UK. If you bring a new strain on, it might be more what we call virulent, so nastier than the strains you have. And certainly we think that the more strains you have on a farm, the more difficult it is to control. And the fewer strains, the vaccine is effective for longer than if it's having to give a response again, if you've got a lot of strains going on.
So either you haven't got a big lameness problem, in which case you don't want to bring lameness in. Or if you have got more of an issue with lameness, you don't want to make it worse. So
exactly.
Regardless of what situation you're in.
Exactly. So ideally, you would put animals through a foot bath, which we'll talk a bit about foot baths shortly, as they arrive, to wash off any bugs they've picked up in markets or transport. And you would look at every single sheep's feet, which certainly if you're just buying rams, however many rams, I think you really should. But even with ewes, if it's possible to, but I realise if you buy hundreds of ewes, then you're maybe not going to turn every single one over, but at least you should walk them around slowly on concrete or hard standing and look for any lame sheep and take them out and turn them over and treat appropriately.
You've mentioned foot bathing a few times in terms of related to the quarantine and also scald. Is it actually worth thinking, because it isn't listed particularly in the 5-point plan, is there a value to foot bathing, or what's your views on foot bathing?
I think foot bathing certainly has a useful place. For actual foot rot or cod, foot baths probably don't penetrate into the foot enough to cure them, so antibiotics are needed as well. And also, if a sheep is very lame, it will hold its foot out of a foot bath anyway. But for purely scald, or particularly for putting sheep through a foot bath after you've been handling, to almost wash off the bugs they've picked up while they've been walking around, as a disinfectant, yes. The important thing is appropriate foot bath, because if you can sort of see on the left there, it's quite a dirty environment. There's a lot of runny sheep poo, or maybe even cattle, but that's an ideal environment to have a lot of foot rot and maybe cod bugs in. So if the sheep are walking through that and then through a dirty foot bath, all you're going to do is wash the infection onto more feet. If, on the other hand, they've been on clean concrete, ideally, if you've just got plain water as a wash bath first and then your chemical bath, then that will be much more effective. But really, if you haven't got dry conditions and some dry concrete before, and particularly to stand on for maybe 15 minutes or so afterwards, you may be doing more harm than good. So yes, it's got a place, but really have a think about is your foot bathing doing good or doing harm, because it can do harm.
And is the concentration you use, because I think you can have things too concentrated and make things worse.
You can. It's one of the things, because usually whenever we're talking about antibiotic anthelmintic dose, don't underdose. But actually sort of formulating one of the treatments we use should really be used no more than 3%, 2.5 to 3%, whereas it often will say making up to about 5% on the label. If it's too concentrated, it will certainly kill off the bugs at that level. If it's more concentrated, one, it stings more, so sheep won't put their feet in it, but also it tends to make the horn more brittle as well, which is, you know, counterproductive in the long term. All the other products, it's as it says on the bag. And there's a range of products available. There is no good scientific evidence about which would be better, or particularly about any of them. To be honest, I think it's actually having the conditions right that's the most important.
And also we're aware that in some instances dirty muck going into the baths can actually stop the solution from working as well.
So that's will make most solutions stop working. And I think so when you see the bath is getting dirty and a lot of muck in, you need to change it. The other thing I would say about formalin, it should never be used inside. It is carcinogenic. It's known to cause throat cancer, maybe the concentrate. So being really careful making up the concentrate, using it outside, having a system that you can't get splashed with it as well. Effective product, but needs to be used with extreme care and sensibly.
And something like the golden hoof and sort of zinc sulfate type of products where it's more granules, that needs a longer period of time.
It does. That's not just running through the sheep. No, so more of a stand-in foot bath we see on the right. The sheep need to stand in it for a while, and that can work with the system, because you can be taking the sheep through, doing something with them, putting them to stand in while you deal with the next lot, and they'll stand in for longer.
Sounds boring, but read the label.
Yes, that's right. And not if all else fails. This is one where you should perhaps start with reading the label.
And measuring as well.
Measuring's very important.
Not a dollop. And the other one I thought would be good to touch on is trimming sheep's feet as well.
That is interesting. I mean, I think most of us would just cringe at that picture and think there's no way you could think doing that to a sheep's feet is going to make it walk better. But this is the one bit of advice on sheep lameness that has changed in the 35 years since I've been qualified, mainly by the work done at Warwick University, where starting with surveys and then actually clinical trials on commercial farms, they've shown that certainly sheep with foot rot, if you inject them with antibiotics and spray their lame feet, or if others you inject with the same antibiotics and the same antibiotic spray, but you trim them as well at the time of treatment, those that have not had the trimming, more of them recover, and they recover quicker. So actually trimming feet when sheep are lame slows down healing. Trimming feet otherwise, people that regularly trim their feet have a higher incidence of lameness, but that's really been drilled down to say, whereas routine trimming probably doesn't help, if you don't actually draw blood, it probably isn't doing any harm, but you shouldn't need to do it. The main thing is to control foot rot. A lot of people ask me, and certainly any drawing of blood is associated with a higher level of lameness in the foot.
Damage to the foot.
It damages the foot and it can't recover properly, and it opens and more bugs get in as well then, and it's bruising, which the bugs love to breed in as well.
Because I remember growing up being told you get air, trimming, you get air to the foot. And blood helps as a disinfectant. But that's completely
it is. Wrong. We know Dichelobacter is what we call an anaerobic bacteria.
So there was some
it grows where there isn't. It likes to grow where there isn't much air, but air doesn't actually kill it. And if you've got foot rot, all the sensitive tissues are inflamed. It's impossible to trim the foot without inflaming them a bit more. So you get bruising, which is just what the bugs like to grow on. So
it's quite similar to kind of bacteria you get as an abscess in the tooth.
Yeah, and in gingivitis in the teeth.
And I always think if I went to the dentist and they started saying, "Oh, we'll just expose it to the air and a bit of blood," I wouldn't be very happy.
No, that's right. Yes.
So that's
someone who doesn't enjoy the dentist, no, I would,
Yeah, so basically trimming, especially over trimming and causing damage is something to avoid.
And people often think about, well, you know, if a foot is very misshapen, hopefully once you get on top of lameness, you get very few sheep with misshapen foot. But if a foot is very misshapen, she's probably been lame for a while or repeated lameness. And although I'm not saying don't ever trim a foot, don't trim it while she's lame. Inject her and treat the lameness. You may need repeated injections to get her sound. If once she's not lame, you feel you want to trim the foot very carefully and not drawing blood, you won't unlikely to be doing any harm. Having said that, if you don't trim it and that sheep isn't lame, that foot is likely to go back to fairly normal, but it might take 2 or 3 months.
I think as soon as you pick up the trimmers, there's always that risk. It's always that sort of last slip that one too many.
So I would say if you're doing your sheep, and particularly if you're doing lame sheep, don't have your trimmers anywhere near it. The other thing that's been found recently is the spirochetes that cause cod can be isolated from foot rot shears being used.
So you're spreading it between sheep's feet through doing that.
And foot rot can be isolated from them as well, so you're causing more of a problem.
So basically no to trimming within 95%.
No to trimming, and certainly no to trimming lame sheep. If I really can't persuade you to stop trimming, at least get them sound first. And most people I've talked to over the recent years about this, once they've got sound, they can't really be bothered to turn them over, or they've forgotten them, or they don't need to. And this is the one message that I do find over the last few years, when you go to meetings, a lot of farmers are now not trimming feet. The occasional ones are still not convinced, but the vast majority are saying, my sheep are getting lame quicker and it's saving me a back-breaking job, and why would I want to do a back-breaking job that isn't actually helpful?
Sounds good. Foot sprays, I just thought it'd be quite good to touch upon, because from my personal experience talking to lots of different people, different definitions of what a spray is, so I just thought it'd be good to clarify that. You know, the purple spray covers a lot of different things.
It
blue
does,
spray,
and different colours they come in now. But I think, hopefully I said earlier, I was talking about antibiotic spray. It's not the colour dye in the spray, it's the antibiotics. So you do need to buy antibiotic sprays from your vets, and antibiotic sprays for scald or interdigital dermatitis that hasn't gone into the foot, just the spray may be enough. But as we said before, with foot rot or cod, both an antibiotic treatment and spraying. But we also, so an antibiotic in the spray as prescribed by your vet, and also spray all 4 feet, not just the one that's affected, because it has been shown, it's usually 1, sometimes 2 affected, has been shown that the non-lame feet of a sheep with foot rot will have a much higher level of the bug Dichelobacter than any 4 feet on a non-lame sheep. So the 3 non-affected feet still have a lot of the bugs. So if you spray with the antibiotic spray, you're stopping them causing a problem. You're also treating the surface to try and stop them spreading, so you're stopping them spreading to the next sheep as well.
So again, check the label, because antibiotic isn't the same as antiseptic,
no,
and you can only get antibiotics from a vet.
Yes.
So if you're going to a local farmers co-op and getting something for feet from there, it's going to be an antiseptic, disinfectant as opposed to an antibiotic. Obviously different approach.
And to treat bacteria, we really want to use some antibiotics.
And some of those disinfectants can be quite harsh as well, so
they can be quite sore.
Trying to avoid maybe those.
And if you've got a severe case, they can be
so really antibiotic is the way to go,
stuff.
and not sort of bother with some of the others which may not be effective for that purpose.
That's right, and we've got plenty of evidence that the antibiotics work.
So finally, we've covered quite a bit, I think. I mean, there's lots of information out there, either on the Farmer Connect website or available online. But I think you probably talk about how you know, a vet is probably the best, you know, first port of call really in terms of working out what's going to be effective for a particular farm situation. So I just thought it'd be quite good just to run through kind of what you think the final steps are in terms of tackling lameness.
Definitely. And just remembering before I do that is just talking about some of the other causes of lameness. Meant to say when we're talking about trimming, there's only one cause of lameness that some paring of the feet is still recommended, and that's if you've got white line disease, shelly hoof, where you get little pockets of dead horn that you can get mud and grit in. That
so
actually
that's like the half moon shape,
like the half moon.
Yeah.
Yes, that's right.
Yeah.
And then pairing would still only be if the sheep aren't lame. If they've got foot rot in that foot, you treat that first,
yeah.
and then just pairing purely the dead tissue away.
Yeah.
You can also get foot abscesses, which sometimes can look a bit like cod because the whole foot is swollen and they tend to burst out at the coronary band.
And you get some pus.
You get some pus.
And heat. And,
yes, but that's not a flock problem.
Yeah.
Sometimes you'll get a few cases, particularly after hedge trimming, you get thorns in, but that would be 1 or 2 cases. And so say there's things that are important to the individual, but not as a...
And we had a picture early on of a lame ram. Obviously we talked about the main causes of lameness in rams, but you can get things like interdigital fibromas, where growth between the cleats and their weight. And
from their weight. Certain breeds are more prone, but
arthritis
also
even,
and certainly that's fine. The growths, if they've had a chronic lameness, you can quite often get growths afterwards, particularly in the heavier breeds. But we also see arthritis, particularly elbow arthritis in rams, and that's a degenerative thing. So if there's no foot rot and rams are chronically lame, you can often feel that the elbows are thicker, and that's where you need to look at culling or euthanasia on humane grounds.
Yeah, so that goes back to vet. So it might be that the vet comes out once a year to have a look at the rams as an MOT, and part of that then looks for any issues.
Part of your ram MOT would be both the fertility, but also looking at any lameness issues. And you know, we would look if it's got a lame ram that doesn't have anything in its foot. We'd certainly be looking at elbows and shoulders as well, but particularly elbow arthritis.
Yeah, and potentially avoiding rams that have grown too fast, maybe as youngsters, or reached their heavy weights too quickly. So
exactly, and that's interesting. That's the same in different species as well. Bulls and dogs, it's the heavier, bigger, quicker growing ones that are more likely to get these developmental arthritis that can become very painful arthritis at not such an old age.
Yeah, so yearling rams shouldn't really be fully grown at that point. They shouldn't be sort of 80% of their mature weight. So keep an eye on that. So sorry, coming back to
so really, what steps are you all going to take? First, working out your current level of lameness, because whereas we're talking about the same approach, you need to have some kind of expectations. And if you're starting with a level of sort of 20%, then I'm not going to expect you to be down to 1% in sort of 12 months. But you need to know, I'd probably be talking about going in with vaccination and prop treatment first, but so that you can get to a lower number to cull. But if you're down at a low level, then we might be having more emphasis on the sort of the very few persistent offenders. But really you want to work out the level of lameness you've got and have a plan so that you will know if you're on track in 12 months time, so that you've counted it now. And also we've talked a few times about involving your vet and about getting a correct diagnosis. Because only a vet can prescribe the correct antibiotics. And they need antibiotics. We can only prescribe them to animals under our care. So we need to be confident about what we're prescribing the antibiotics for. And it's not you're then going to have the vet out to see every lame animal. It's about having a plan saying, this is what we're going to use. I'm happy to dispense this, and we can write up, we're going to prescribe this, and then monitor over a year. We're always worried about overuse of antibiotics. When you're first starting a lameness control plan, it may be that you use more antibiotics in a short term because you're treating animals promptly, and we know the quicker you treat them, the quicker they will get better. So that's good for them and stop spreading it. But over the long term, in a year or two's time, you'll be using minimal antibiotics for lameness. And that's all about implementing the 5-point plan. And there's some really good booklets that you can go through, and there are both vets and some SQPs that have trained up to be a lameness reduction advisor. So it's certainly worth going through the booklets with them, going through the 5-point plan, seeing where your strengths and your weaknesses are, so to know what to concentrate on, but don't forget the rest. And then monitoring the levels. It's, you know, you can have a real blitz on everything, and in 6 months' time everything is great. But don't forget to keep treating your sheep promptly. Don't forget to continue with vaccination. There are farms that have, there's not many that have eradicated foot rot in the UK, but there are some, and there are some that have got lameness down to a level that they feel they can carry on without vaccination. But that's not something you do after just 12 months, and that's something to monitor and keep speaking to your advisor and have a little annual check.
And speaking to people who've implemented it and who have reduced their lameness levels, it does become a lot easier. So if you keep up with it, it's easier over time because it's infectious. So if you reduce the infection, it's not there to spread to other animals. So
exactly.
I think,
and once you sort of, if you're confronted by a field of lame sheep, you think, well, I'll be always on the go if I'm treating everyone that's lame within 3 days. But you get your lameness level down to under 2%, and then, you know, it's quite easy to spot them and catch them. And certainly some farmers I've worked with or know who've reduced lameness from a high level to a low level. The main thing is, we all know lameness affects our sheep. We all know it's a lot of work. But people who've reduced it have always said, I didn't realise quite how much work it was, and that it's so much nicer and easier keeping sheep when you're not banking on with. There's so many other things you can do with your day.
Yeah, and I think that's probably quite a positive note to finish on.
I hope so. Yes.
Basically, there's a bit of work to be done to get on top of it.
There is, but we're getting there, and we can get on top of it. Once you're there and you keep
on it, it's a lot easier, and it revolutionises, I think, people's sheep keeping to actually get on top of lameness. So
and then keeping sheep are a joy, as they should be.
Yes, that's a very good note to end on. So thank you very much for spending the time today to go through this with me.
Thank you.